avoid hospitals from being overrun again, avoid a second lockdown at all costs. France and also Spain, the UK and others are all asking one simple question: how to live with COVID. In the past 2 weeks, the number of French COVID patients in hospitals has doubled. We're seeing that operations are now starting to be postponed in the Paris area. So why are citizens in some of the hardest hit areas like Marseille so angry at new restrictions that include, as of Saturday, the shutting of bars, restaurants, and gyms? Our show includes France 24's reporting from Sweden, where despite a no lockdown policy that decimated nursing homes, you'll hear from one assistant school principal who describes her weeks of agony with coronavirus as a necessary sacrifice. We'll also go to Stockholm and ask if that faith in the system will hold now that winter is coming to Scandinavia. It's not just Sweden, but all of Europe that will now move indoors until spring. Asking how to live with COVID is also asking how to live in times of COVID. We're social beings, us humans, with how many parties, school plays, weddings or funerals canceled or curtailed. Will we still be the same when it's all over? Today in the France 24 debate, we're asking, well, how to live with it. And joining us is France 24 senior correspondent Catherine Norris-Trent, who was in Sweden. We'll talk a little bit more about that in a short while. Thanks for being with us.
Thanks, Francois.
We're also with Dr. Viviane Coves Masfetti, professor of public health at the University of Michigan and the University of Paris. Thanks for joining us. From Stockholm, virologist Lena Einhorn from Uppsala is with us as well. Thank you for being with us.
Thank you.
Pleasure.
And from Uppsala, north of the Swedish capital, Stefan Swartling Peterson, professor of global health at Uppsala University, co-founder of MSF Sweden. Welcome to the show.
Nice to be on. Thank you.
The France 24 debate on Facebook and Twitter, hashtag F24debate. The UK has a rule of 6, the city of Paris a rule of 10, with bars shut at 10 p.m. As of next week. And in other parts of France, it could be worse. Solange Mougin has more.
Unveiling a new color-coded map, where the darker the color, the higher the alert. France's health minister explained that 2 areas of France, Marseille and Guadeloupe, have reached the maximum alert warning for the coronavirus. It's the last step before having to declare a state of emergency for health reasons. The government has told local authorities to tighten restrictions. In the southern city of Marseille, that means bars and restaurants are to be shut starting Saturday, and for at least 2 weeks. The restrictions came as a surprise for the city's mayor, who expressed anger on social media for not having been consulted. The head of the region also tweeted that the measures felt like a punishment. For restaurants and their clients, the impending closures were also a blow.
Je suis assez choquée de dire comme ça aux restaurateurs au dernier moment qu'on ferme et c'est pas normal.
Les commerçants, ils reprenaient à peine leur souffle et là, c'est une catastrophe.
For Guadeloupe, the French overseas region, which is also at maximum alert, bars and restaurants are closing as well, along with public places that don't have specific sanitary measures set up. Hospitals on the island fear that they're reaching capacity in intensive care units. 37 military doctors have been deployed to help, but healthcare workers say the cases keep on coming in. Testing results show that Guadeloupe is currently at 5 times the alert threshold for positive cases.
Catherine Norris-Trent, let's start with a personal anecdote. You've been covering for us the Charlie Hebdo trial. It's suspended because of COVID?
Well, we don't know if it's COVID right now. One of the defendants in this huge terror trial that's taking place in Paris fell ill in the dock and the trial had to be suspended. He's going to have a COVID test. And there are questions about whether the trial can continue. So, yeah, we don't know at this stage, but maybe.
The new measures announced, Dr. Coves, it's everybody in France is talking about it. Everybody's divided. Is it too much? Is it not enough? And they're having the same argument in the UK, the same argument in Spain. What do you think of what was announced by the health minister Thursday?
What I think really is that today I am very happy not to be the Ministry of Health in any country at all. I think their decisions are terrible. extremely difficult to take. And what makes the things very complicated is that not everybody in the society has the same interest. Let's say if you are a 20 and you just enter a business school and you want to make integration and things like that, you were dreaming about it, or you are 70 and you know you are a target and you may die. So, those people, they do not have common interest. And I should add also where you are living. You are living in the center of Paris versus you are living, let's say, in Brittany. It's absolutely not the same concentration of human beings. The rules are not the same at all. So, it's one, in my opinion, is one of the reasons people are so much discussing, is that their interest are absolutely not the same.
Do you think it's, I hope I'm not exaggerating by asking this, tearing apart the French a little bit? Because we'll talk later about the difference between Paris and Marseille, but it's also a difference between generations. I'm hearing a lot of Parisians saying, oh, those young people, they're going to go party at the Canal Saint-Martin and they're congregating in bars and they shouldn't. Is there a sort of a rift between generations?
I don't think so. I mean, it's very hard to answer to such question. But what's true, the data are there, is that your reaction will mainly depend on who are you. Are you, for example, working in a sort of work you could not work from far? There is a lot of profession. You cannot do that in front of your computer. And personally, I thought it's a bit bizarre that the people who can work in a remote way are complaining so much, because in one way it is a chance. Of course, the second aspect is the children. I mean, if you have children, and if the question of the school is crucial. If you have children, and you are a parent, you're not on the same position that you do not have children, or your children are grown up and it's not your problem anymore. So imagine you should remote work, but on the other hand, you're not sure if your child could go at school tomorrow. That's a real problem.
Remind us of the rules in schools right now.
The schools, well, they are complicated, but basically children under the age of 11 in French schools do not have to wear a face mask. So all the adults do, all teachers, assistants, staff, and parents when they go and collect their children. Over the age of 11 in France, all children, as well as all the adults, have to wear a face mask. If there are 3 confirmed cases of children being ill, the classes will be closed. And they have to do COVID tests and prove it's negative, or have several days, a week without symptoms before schools can get back. So we're set for some disruption this time.
We knew there'd be disruption with the school year began. As someone who has experienced homeschooling, your thoughts on how it's going?
Well, so far, Francois, on a personal level, the schools where my children go have remained open. So for that, we are thankful, because it is extremely difficult, as we all know, to work at home and try and maintain a job while also looking after children. I mean, people are nervous. Some people are nervous.
We may add that they recently changed the rules for the which probably make a difference, because before it means that any child who will be positive, they will close down the school, the class at least.
Yeah, they've loosened it up now, so it has to be 3
which
children.
is, really a lot, giving the fact that, in fact, the children are not contaminating so much between themselves and even towards the adults. It's mostly the reverse that happens.
So we're still learning at this point, because it's so new.
Yeah.
It's so impressive.
That's my second point. That why people disagree so much is that, first of all, they are absolutely not living the same situation. We can maybe summarize, but there may be 10 totally different situations where it's very understandable that your reaction will be different. And then, in the top of that, it is that we still do not know everything, and we are still learning. And so the government has to take measure, let's say, working. That means maybe tomorrow we will learn something new, or maybe after tomorrow we will get a vaccine. So you have to adapt, and people consider that as incoherence.
The numbers are real, certainly. Hospitalizations in France at their highest level since the end of lockdown back in May. Already some medical facilities saying they're having to free up beds. Nearly 1/4 of the beds in the Paris area are due to COVID. This is a graph showing the daily hospital deaths in France. And we can see what it was like, in those days back in the spring. Non-essential surgeries are going to start to be postponed in the Paris area as of this Saturday. But when they announce those new social distancing measures, again, it's that question of lives versus livelihoods on the hashtag F24 debate. The owner and chef of the Plein Ouest restaurant in Paris, Didier Kemner, tweeting the following, that restaurateurs are furious, and rightly so. Paris makes decisions without consulting. In this case, it's the government, the Prime Minister's office, Matignon, trying its best to kill all economic activity, except those directly linked to the stock exchange, of course. So that gives you, before we talk about Sweden, Lena Einhorn, that gives you a flavor of the mood here. What's your reaction?
Well, we have a very different policy here overall. We never had a lockdown, and now the number of cases are rising here, and so far there has been no change of recommendations. So we have not reached the situation yet where you are at this point, but in the spring we had for some weeks the highest death numbers per capita in the world. So we are a little apprehensive.
A little bit apprehensive. Catherine, you and James Andre of France 24, you sat down with the head virologist of,
the state epidemiologist.
Excuse me, the state epidemiologist, and spoke to him about it. 533 cases recorded in Sweden on Thursday, the most since July. And unfortunately, we are seeing, as Dr. Einhorn said, a bit of an upturn. 2 weeks ago, this was 2 weeks ago, this interview, Anders Tegnell, upbeat nonetheless when he spoke to us.
I think at the moment we are very happy with the strategy. The number of cases has fallen in Sweden during the last couple of months. We're now down to very low levels, lower levels than most countries in Europe actually right now. Our mortality has gone down to almost zero. We have very few cases in intensive care and almost no cases in our hospitals anymore. So right now we're quite happy, and we are heading into the fall with some confidence.
Ready to go into the fall with some confidence. Do you share that confidence, Stefan Swirling Peterson?
Well, I think, as you rightly pointed out, COVID is here to stay, and we're going to have to live with COVID. And 0 cases is not an option, and no one has the answer. So we are learning as we go along. Sweden has made mistakes, but I wanted to point that we have done something very right, and that is to keep primary schools open throughout. We've also shown that although we had big community transmission, we have not had serious COVID cases in kids. We have not had mortality in kids, and teachers in Sweden, primary school teachers, were not more sick than other professional categories that you can compare to. So keeping schools open and primary schools open is what Sweden has done right. And that's what I would implore France and the rest of the world to be doing. As we speak now, 850 million kids in the world still don't have a school to go to. And that's not just a loss of learning. That's also a loss of security with domestic violence. It's about losing maybe your only meal, and it's about lots of mental health and mental illness and bad symptoms. And this affects the poor much more than it does the better off in all societies. So I think let's try to learn. And let's, for God's sake, keep schools open and concentrate on where we know the transmission of this virus is. And it seems from what the European CDC is telling us today, it is in young adults.
So, Lena Einhorn, do you agree?
No. First of all, I want to say that being optimistic is in the DNA of Anders Tegnell. And in the spring, when we had, as I said, the highest death numbers in the world, he kept saying that the figures look very good, and we are flattening the curve, and we're reaching the peak. We have had at least 50 cases of severe inflammations in kids in in Sweden. So it's not true that we haven't had kids with problems. The issue of kids is an important one. I couldn't hear you.
All of whom have recovered.
Okay. Yes, but you said that there were no difficult. These are severe inflammatory diseases. So I mean, it's not. And the issue of kids is an important one, and it's a tricky one. I mean, there is a study that was published in MMWR, the CDC weekly report from a big camp in Georgia with hundreds of kids, where there was a major outbreak. I mean, about 70% of the tested kids were positive, and the biggest amount of positives were in the 6 to 10-year-olds. Now, they don't get very sick usually, but it is a lingering issue. What once in the Swedish data, they say that, you know, the Public Health Agency, that the teachers are not more exposed than other groups, professional groups in Sweden. But if you separate the teachers of the young kids, which stayed in school, with the older kids who didn't stay in school, you see that it's maybe 50% higher COVID-19 incidence in those who actually were working in the spring.
When we come back, I want to get Stefan Swartling's Peterson's reaction. We'll take a quick break. You're watching the France 24 debate. Welcome back, or welcome if you're just joining us. It's the France 24 debate as we head towards the winter months and kids are back in school. We're wondering how the spike in COVID infections across Europe is going to play out. We're asking how to live with COVID and talking about it with France 24 senior correspondent Catherine Norris-Trent, Dr. Viviane Coves-Masfetti, professor of public health at Montreal's McGill University. Welcome back. Welcome back as well to virologist Lena Einhorn, who is with us from Stockholm, and from Uppsala, north of the Swedish capital, Stefan Swartling Peterson, professor of global health there at the university, and co-founder of MSF Sweden. We were talking about the impact on being in school or missing school as opposed to the impact of the dangers of being exposed to coronavirus before the break. Catherine, you went to a school where the kids' parents got infected, the teachers got infected, well, and everybody seems fine about it.
Swedish children bustle into school just as they have right throughout the COVID pandemic. Classes here have been running and compulsory for all pupils up to the age of 16, with no face masks.
I think it's good that they don't wear a mask, actually. I have 3 kids. And I think it's important that they go to school. Otherwise, it should be very difficult for me to work.
Hygiene measures have been ramped up, but staff here believe keeping open was essential, especially for struggling students.
They need a physical presence. They need a teacher in the same room as them to cheer them on and to clarify things. And most of the time, those students, they will not ask for help. They will just sit and wait until someone comes up to them.
Unlike most school children throughout Europe, these Swedish pupils haven't had to miss a day of class due to coronavirus. The public health authorities made a decision to keep schools open and stuck to it, even when the death rate was 10 times higher than in Sweden's Nordic neighbours.
My dad had corona when it first came to Sweden. He was sick for like 6 weeks. My dad was ill too for 8 weeks. I'm happy we didn't shut down. In the beginning, when people had quarantine, I was like, why don't we have quarantine? I didn't really understand. I didn't know if I got sick, what will happen. Now when I know more, I don't feel unsafe. I don't feel at risk because I'm not like old.
20 out of 70 teachers here caught coronavirus, as did the assistant principal.
For 3 weeks I couldn't walk out from the bed. I couldn't eat, I couldn't sleep, I couldn't walk. I was really sick. I do think I made a sacrifice, yes. But I think it's worth it because it's about our children and they are the most important thing we have.
Many Swedes argue this has been a risk worth taking. An opinion poll published this week showed 60% trust authorities' handling of the pandemic.
Viviane Koves-Masfeti, it was a sacrifice, but it was worth it, says that assistant principal. Your thoughts on that?
I think when we are talking about lockdown, I realize that there are different pieces, and the different pieces do not have the same value. So let's say there is the pieces of having the restaurant open and having the bar open. That's one thing. I fully understand that for the business is awful, and but hopefully we could think that the state will provide some help, so the people will really not lose everything. But on the other hand, you have the children, and I think I have seen a lot of things, but for the children, it's very difficult, especially for the young children. It's difficult if it lasts long. It's a question of duration. I mean, if you don't go to school, let's say 2 months, okay. If you don't go to school 6 months, 7 months, 8 months, it's become really a very, very long time. And I think we also have to take in consideration the duration. However, one of the things is the perception of the population. I mean, I fully understand a teacher who will say, I got the virus, but it's worth doing it because our children are so important. I'm not sure if we make a survey on the French teacher, you will have a lot of people.
Why is that? Why is it that in Sweden they're
First of all, we didn't have a survey. I mean, I am an epidemiologist, so this person is feeling that way. I admire it and I appreciate it. I suppose the parents appreciate it as well. However, I do not have data about, let's say, 1,000 randomized teachers all over Sweden to know if this person is really particularly positive or if she is representative of the teacher opinion. I really don't know, but maybe our Swedish colleague know more about that.
Yes, let me ask Stefan Swartling-Petersen, because we had Lena, as Dr. Einhorn said, she was on a show with us during confinement, and she warned us that the death toll would be high, that it would be awful in places like nursing homes. And that's exactly what happened. And yet, surveys show the population in Sweden supports the government. Why?
I think, as we alluded to, we generally trust government in Sweden, and certainly there were big issues around the quality of and organization of nursing homes, and we've heard Swedish media report extensively on all the mistakes that were made there today. But I think the one thing that we did appreciate was that our kids could keep going to school, and we also could keep working. Most of us worked from home, those of us who could, and I think this was particularly a gender issue, because as we know, a lockdown is something that affects women and children much more than it does men in society. And I think what we're discussing here, we're confounding a lot of discussions here. We have had 0 deaths from COVID in children in Sweden. And around the world, those deaths are a handful. It's much less than influenza. Luckily, COVID is not a children's disease. I've just been Chief of Health for UNICEF globally for the last 5 years, and I followed this. And we were very happy and lucky that COVID was not specifically targeting children. But what we have seen is a lot of dead kids because their mother could not deliver in a hospital, because the quality of the newborn care went down, because the care was closed. And we see lots of domestic violence affecting kids because they are home from schools, etc. So we need to look at the whole picture. And for children and for women, it's much definitely better that we keep schools open and that we keep societies going. But if you give me a choice, close the pub and keep the school open, Unfortunately, the political pressures put it the other way around, but there's no evidence to support putting it that wrong way. Keep the schools open.
Catherine Norris-Trent, we've seen, we saw this Thursday, a glowing report in the Financial Times about neighboring Finland, which did have a lockdown compared to Sweden. Yet when you were there, again, people defended that Swedish model for the most part. Not everyone, though.
No, not everyone by any means, and just anecdotally. But most of the time, we asked people in the street, members of the public, what they thought, and the overwhelming response we got was, "I don't feel qualified to answer this question. I'll leave that to the experts." There is a real, perhaps, difference of opinion in France, where in France, if you ask a person on the street, they will have a very strong opinion about it. I found that quite striking. People were unsure. There was a great deal of uncertainty. People knew that Sweden clearly had a higher death toll than Finland and Norway per capita. They were very concerned about what had been going on in old people's homes and the deaths of thousands of old people. And yet there was a kind of a cautious optimism, people saying, maybe it's working, just maybe. And people are waiting for this to be over, very cautious, trying to look at the evidence. A lot of people also told me, look, winter is coming and we will be inside. There were a lot of people cycling and walking out on the streets of Stockholm. Those people will be going into buses and metros and will be in inside spaces. So people wondering what is going to happen with that. And they also said that even though there was no official lockdown, people kind of did a voluntary lockdown. They stayed off the streets a lot because the authorities told them to. So it's very different. It's more nuanced, perhaps, than it looks from the outside. People deferring really to the public health authority and cautiously optimistic, I'd say, among those I spoke to in Stockholm.
Dr. Einhorn, Catherine Norris-Trent bring up an important question here, which is that, is it still too early, even though it's been more than 6 months since we've had the first lockdowns in Europe, is it still too early to draw conclusions?
No, I mean, the Swedish Public Health Agency has often said that wait a year and we'll see if the other Nordic countries don't sort of surpass Sweden. They will never surpass Sweden. I mean, per capita, Denmark has 5 times less, and Norway and Denmark 10 times less deaths. There's no way they're going to catch up. I want to say a few things, because a lot of issues have been brought up in the last few minutes. The first thing is the reason people in general think there are many reasons why people support the policy, and some of it is psychological, etc. But you have to understand that the people who have paid the price are mainly the 70 pluses. 90% of the people who have died are 70 plus, and a very large proportion in elder care, in care homes. So people don't necessarily sort of perceive the problem on a personal level. That's the first thing I want to say. The second thing with regard to kids don't get very sick often, but they spread it. And one thing that you have to realize about Sweden, which is the most absurd thing about the Swedish policy at this point, is that there are a couple of things that virtually all other countries do and Sweden refuses to do. One of them is face masks. I mean, there are very few countries in the world. Last I heard, it was like Somalia and Yemen and Sudan and Sweden that don't either recommend or mandate face masks. There is an opposition to face masks in Sweden. And the other thing that, and the interesting thing is, you don't even see face masks in hospitals. You go to the doctor, you go to the ophthalmologist, you sit this close to them, and they don't wear face masks. So that's one thing. The other thing that most countries in the world, or at least in Europe, have is quarantine for household contacts. In Sweden, it's the opposite. Until 2 weeks ago, it said on the webpage of the Public Health Agency, what do you do if someone in your family or your household has COVID-19? Answer, if you don't have symptoms, you go to school and you go to work as usual. Now they're talking about possibly in high problem areas like Stockholm, instituting home quarantine. But today, they said this will not affect the kids. The parents will stay at home, but the kids have to go to school. And there are parents who are in risk groups, and they have to send their kids to school. Even though they're talking about home quarantine, doesn't apply to the kids.
Stefan Swartling-Peterson, on the issue of face masks, is it true in Sweden you don't have to wear them?
No, you don't have to wear them. They're not mandatory. I carry one in my pocket, and which I'm prepared to put on when I'm on a train and it gets crammed. But if I'm walking alone in the street or in a sparsely or in a forest, as we tend to do in Sweden, I can't see why. There's no evidence that this face mask work, nor is there any evidence that it works in young kids. But certainly, I agree with Lena. It would seem reasonable. That's why I carry this, and that's why it's also there's recommendations in certain places in Sweden. I think we could do more on the face masks, and certainly there have been other mistakes. But in general, I think it's not all or nothing, and this is not about being for or against the authorities. I think we have to look at specific groups here, and my point is to say, not to defend the Swedish policy overall, but to say that something that Sweden has done very right, and we also heard the evidence before, is to keep schools open, because it is adults who give COVID to kids. It's not kids who give the COVID to adults. And children in Sweden didn't have to pay the price, but in Finland they paid the price. They have bad statistics on psychological distress, etc., and loneliness in their kids, and across the world.
Even if you're in a household,
the price now.
Even if you're in a household, as Dr. Einhorn was saying, where you have parents that are in an at-risk group, should the kids be forced to go to school?
I don't have an opinion around that, and I think some of those, obviously, some of those recommendations may need to be modified. Similarly, if I was a 60-year-old teacher with diabetes and high blood pressure, I think we need some leniency and we need some adaptation there as well. But the point is, we can't lock all kids at home. 850 million kids in the world still don't have a school to go to, because some kids may have particular situations, because some teachers may be in a particular sensitive situation, because the kids are paying prices, and they're paying a different price, which we are not counting. And COVID will not go to zero. We're here to live with COVID, and we need to live with it in a way that actually promises a future for our children, that they survive, that they thrive, and that there is a tomorrow. So that's my point.
And that brings us back to the point that Viviane Coves-Masfety made.
Can I just
very briefly, go ahead.
Can I just make a comment on? Yes, I mean this was not a very representative statement of the situation. I'm very happy that Stefan walks around with a face mask, but he's pretty alone doing it. I mean, I'm not saying nobody does it, but I don't see ever face masks in the streets of Sweden, and perhaps in public transport there are 5% maybe will wear face masks, but basically there's a stigma now around face masks in Sweden.
Catherine North-Trent, you confirm that?
Yeah, that fits in very much with what I saw in Stockholm, certainly a couple of weeks ago. You don't see any face masks around. So, not only they're not obligatory, they're not recommended. Public transport, you see a few, but not very many. There are a few people who are protesters calling for face masks to be introduced in Sweden, and they gather every Saturday and do a demonstration, but it's very small.
So wait, in Germany they have demonstrations against them, and in Sweden they have demonstrations for them.
They do, but they are small groups of campaigners at the moment. Right. Maybe it will grow, but it's a very different mindset, it feels.
All right. We were talking about in part one, you said you didn't want to become health minister at the outset of this, Dr. Coves-Masfety. You also talked about, is this putting a strain on the interest, generational strain? There's also, and this is another question that we're finding here in France, because it is a bigger country than Sweden, is it also a regional strain? In other words, could it become tribal? At the start of the week, there were 105 COVID patients in intensive care in the greater Marseille area for only 300 beds, say doctors. But we saw when the city's football team beat arch rivals Paris Saint-Germain for the first time in 9 years. Yeah, there was not much social distancing. These are images from middle of the month, a couple 11 days ago. Not much social distancing at the Canebière, the port of Marseille. Politicians there, nonetheless, insist the curve is receding. They say they've got a lower infection rate than Paris. The socialist deputy mayor Benoît Payan, in a Twitter thread, where he blasts the government, writing, "Despite the evidence, despite the numbers, one more time, our territory is sanctioned, punished, ostracized. Marseille cannot be used for shows of power." His constituents agree.
Je suis allé hier faire mes courses en grande surface, je veux dire, alors soit on ferme tout et vraiment on s'occupe de notre santé, mais de cibler les restaurateurs, je ne comprends pas.
Je ne vois pas pourquoi un bar ou un restaurant serait plus dangereux que d'autres commerces.
Ça m'a impacté ma vie sociale. J'ai envie de voir mes amis, j'ai envie d'aller au restaurant, j'ai envie de faire tout ça.
Is it becoming, Viviane Coves-Masfeti, a Paris versus Marseille thing?
No, I do not think so. If we should not forget that I think in March or April, there were TGVs that were transferring patients across France. So there is solidarity. I think, what is very difficult in this talk is that on one hand, you are talking about dying. In the other hand, you are talking about not being able to see your friend. So we are not talking not about the same thing.
Now, here's the heart of the matter with what the Marseille politicians, and by the way, it's not just Marseille, it's also the mayor of Paris who's complaining. They're saying the government has not consulted with them as they promised they would do. That once again, it's France where there's orders from the top instead of dialogue and consultation. And they point to neighboring Germany and say over there's a better communication between local authorities and the federal government, they say.
First of all, as you know, Germany is organized in a completely different way. I mean, you have the Länder, and the people who are responsible of the Länder, they have some possibility to organize the healthcare. In France, it is not exactly like that. In France, it is centralized. And as you can see, there has been a lot of effort today to decentralize, to truly decentralize. And it is part of our policy, actually, at least it is claimed to be, that it will be more concertation.
The politicians from Marseille claim that's a broken promise.
Yeah, but politicians are politicians. I mean, they are claiming that's the problem of advocacy. I think it's one of the problems in that situation is be careful not to make too much advocacy from something that is not respecting all the aspects of the situation. Of course, I fully understand that for the restaurants, it's awful. Now, there are different ways of dealing with that. One of the ways is to say the government is awful, it's an imposition, and then the other things is to try to fight, to obtain some reconversion, some help, to be concrete. That means, to try to find a deal that makes the people surviving in their activities. I mean, to frontally explain that the government is doing nothing, it's very confrontative. I think one of the problems in France is we are very confrontative.
All right. Our guests over in Sweden must be chuckling at us playing to stereotypes, Catherine, because the national sport in France is second-guessing your leaders. Do you have the sense that since the start of the pandemic, the French have come together more or been torn apart more?
Well, that's a difficult question. I mean, you're right in that people in France love to criticize their leaders and give them really famously low opinion ratings. Look, it's difficult to say. I think there was a moment of people coming together when this was, at its height in March and April. There was a sense of people, this is a dramatic time, we're going to come together. There was lots of solidarity, people helping out their neighbours, helping out the poorer people in society, trying to support local producers. I guess as it goes on longer term, maybe that will start splintering. Maybe that's what we're going to see now. And if there are local lockdowns, that puts a lot of pressure on things as well.
If I can add, that's also the responsibility of the leaders. I mean, you have different ways to play the game. I mean, either you can say very loudly that, the government is doing that and that, or you can explain, or you can temporize. I mean, I think it is a true responsibility today of the political leader not to put benzene of the fire.
Stefan Swartling-Petersen, we're almost out of time, but let me ask you, do you get the sense that when it's all over, this period of lockdown, of uncertainty, of not knowing, the kinds of which it's been compared to periods where humanity knew plagues, Will it leave a lasting impact on our psyche?
No, I think it will change us, but I don't think we will be after COVID. We will be with COVID. It will always stay with us, even after some vaccine comes. It will not be perfect and not everyone will take it. So we have to live with it. We have to protect our vulnerable groups much better than we did in Sweden, as Lena Einhorn just referred to. We have to stop the transmission where it happens, and it happens to be in young adults and in pubs and hockey games and what it might be now in the case of Sweden. And we should not victimize kids. Kids belong in schools, and going to school is the most important determinant of health for any child, and that's our future. So we're going to have to adapt with this and live in a different way.
Live in a different way. We're going to have to leave it there. So much more to talk about. I want to thank you, Stefan Swartling-Petersen, for joining us from Uppsala, Lena Einhorn for being with us from Stockholm, Dr. Viviane Koves-Masfeti, Catherine Norris-Trent. I want to thank you for being with us here in the France 24 debate.